tonight on this episode, I am honored to introduce two of the New York City Dental Smile team. Phenomenal, two wonderful people, Dr. Ben Elchami and wonderful Dr. Maria Tamay. So I had the honor to meet you over the years. Ben, gosh, we go back many years,
yeah.
many years, and I've seen you do so many things in your life. And then I'm happy that you joined us.
I'm happy to be with the team.
Yeah. And Dr. Tamay, I've met you through Dr. Castillo, and we became bonded. We bonded together, and I really love you and respect you. So thank you also for joining me on this journey.
Thank you.
With that story, with that little introduction, so what would you like to have the listener know about you? Let's start with you, Dr. Tamay.
Well, it's an honor to be here. I think it's a wonderful opportunity to be part of your group and be part of an atmosphere that values like dentistry, mentorship, and like overall like helping the patient out. I'd love them to know that I am eager to learn and grow. So anything they see out there is basically me trying to test myself and like push my boundaries and grow, I guess.
Yeah. For me, I'm also very happy to be with the team of very talented colleagues. And yeah, I enjoy what I do, and I enjoy my time with my colleagues and the patients that I treat, and the relationships I get to build, and the things that I learn every day. So it's a true pleasure.
Fantastic. So what first pulled you towards this profession? What made you decide you want to be a dentist?
Well, obviously I had many rounds of braces and like a great, like every dental student. I basically had a great experience with my dentist. I always asked questions. I was always a curious one because growing up, it was like, this is something new. And I knew I wanted to be in healthcare just because I always had to like translate for my parents. So I was always asking doctors certain things. I'm like, I want to be them. Like, I want to help out. But dentistry, basically, I just was in college. I'm like, what do I do? Medicine, dentistry, like, I'm not too sure. So I kind of just made like a whole cover letter and went to a bunch of dental offices and asked to volunteer. And only one of them was like, yeah, come in. And there I was exposed to like beyond my regular fillings and braces and stuff. It was like the whole works of dentistry putting together. And I fell in love. I'm like, this is something that seems rewarding because you could actually see a visual change. And I'm a very visual person. So then we just went on with it.
Excellent. And you, Dr. Benny?
Yeah, for me, actually a similar story. I didn't really find my way until college. So I entered NYU undecided kind of, and I took all the basic courses. The summer after, I was thinking maybe to go to the business school. The summer after my first year, I volunteered in a hospital, and I got into the medical world, and I fell in love with the medical world. It was really, I got to know an anesthesiologist, and he let me come in and observe a bunch of surgeries. Cardiac surgeon. I saw triple bypass open heart surgery, and I was completely blown away. So after that summer, I went to my guidance counselor, and in the back of my head, I was thinking, same, should I do medicine? Should I do dentistry? And I asked the guidance counselor, he said, well, it's basically the same courses for the next 3 years in order to apply to either dental or medical school. So get yourself on the program and figure it out. And through the 3 years, I explored, and I realized very much the same, that you know, I enjoy constructing and putting things together. And I also enjoy visual artistic things. And dentistry has all of those things with the medicine included. And so that's the route I went. I didn't even apply to medical school or take the MCAT or anything.
Well, we got lucky.
Well, thank you.
Patients got lucky too.
Yes.
All righty. There was any time throughout your education and dental school you decided that this is more than a profession? more than a job. Sorry.
Just through the education part or throughout my work?
Sometimes people go into do a job because it's a job.
Mm-hmm.
It's a paycheck and whatever. But sometimes some people are passionate about something. And there was any time where you felt that this is more than a job. Obviously, both of you have, steamed it and in your head to get into dentistry. So there's like any time like it was a click like this or?
Yes, I think for me in school, it was the first time I was live with a patient. And it's a human being, and it really clicked that, I'm working on someone. It's not a book anymore. It's not and that was the game changer for me. And, I was nervous in the beginning, but as I worked through it and began to help the person, I realized how rewarding it is for the patient and for me too. It was a good feeling. Also later on, the moment that clicked for me, I did a couple of volunteer things. One was in upstate New York, helping homeless people, doing all kinds of digital dentistry for free. And I was there for 3 days, like 9 hours a day, just treating. And these people, they gave me hugs and it was so gratifying to be able to help these people.
Mm-hmm.
And the same with another trip I took to Mexico, a small village, treating pediatric patients. And actually one of them, he was a little older. He was working in a restaurant. We went out to dinner. I pulled a tooth.
And dinner?
And he was working that, and he's like, the only reason I made it to work tonight was because you got me out of pain with this tooth. He gave me a huge hug and he brought me a bottle of wine. So, those kinds of things really click for me and make me feel good about what I do. And yeah.
And you, Dr. Tamay?
Obviously, like the one-on-one experience with patients in school, like I went to Stony Brook, so it was very far out in Long Island. And obviously, like I was probably like one of the few like Latinas there. So essentially I was given all the Spanish speaking patients. And then it was nice to communicate with them. And one of the patients had like implantes, and I'm like, whoa, like this is something you see in textbook. Like now I'm responsible for like following up with her. And it had to be like the most detailed notes ever. And I'm like, this is a lot of responsibility, but it was very rewarding because like she was like, nobody kind of explained this or went out of their way to do this. So like realizing that you're responsible for like the patient's health was like a click, like, oh, this is me for the rest of life now.
Excellent. Well, like implants, it's a very common thing, but very little people diagnose it properly and treat it properly. Yeah. So have you had any influences or mentors during your time that influenced you, that you will always remember them? And so what do you think?
Oh, for sure. Like the one dentist that was like, yes, you can come in and like shadow me. Like she was very much into airway and like TMJ health. Like even before I knew those things existed, like sleep apnea. And I was like, why is she going in depth, like doing all these exams for people? And she's very like holistic, like, it's all systemic. Like it's not just one little thing, or like everything is occlusion. And like I went into dental school thinking these things, but everything they taught was like the most basics. I'm like, wait, but that doesn't make sense. Like these little things don't click. And so she's a great mentor because with her, it's like, it's not just a single tooth crown. It's like, look at the opposing side, look at that. And she made me like see things from a greater point of view that I don't think I would have unless I was exposed to her. Like, so amazing. I love her. Yeah.
And you, Ben?
For me, it's a long time ago. I would say my attending at residency was a big mentor for me. After I completed my residency, he actually took me in to his private office as an associate. And he was very heavy into digital dentistry. So I got into the scanning and intraoral scanning when this is 20 years ago. Oh. It was a lot more technique sensitive. And I feel like, and we went to CE together, continuing education together. I feel like it really improved my dentistry. And I learned so much from him and from the continuing education that we took together. And it was good to have him as a resource and a backup in the beginning of my career, gave me a lot of confidence. Yeah.
See, I get to know more about you guys. So, so that's Peggy on the thing that you just said, digital dentistry and stuff. So, true that everything we talk about, how now digital has been within our hands. So you've experienced it at the beginning when nobody believed in it. So now, yeah, digital was 20 years ago, yeah, when it started. But so what do you think about now, dentistry now and dentistry in the coming 10 years, in your opinion?
I mean, for me, I feel uncomfortable not using it at this point in my career. I can't remember the last time I took a physical mold impression.
Mm-hmm.
And as I said, from the beginning, digital dentistry was very difficult because it was like one picture. So
and you had to put the
powder on it to make it all one color.
This,
I don't know that.
So
yeah, you put powder. We used to put powder on the teeth and for us, that's why in the surgery did not come in, because
you can't keep a dry field.
Yeah.
So to take the picture, if the picture is angled,
and that's it freezes
wrong, your restoration will never fit. If your prep is undercut or there's something off about the prep, the restoration will never fit. So it's very, very technique sensitive. You have to get everything perfect, from the powdering to the prepping to the scanning. In the beginning stages, I feel like it's gotten much, much easier now.
At least there's no powder, you see? She didn't hear about it. Yeah, it's a lot of things. I know I asked him about digital. I'm not excluding you from that question.
Okay. It's okay.
But let's spin it up a little bit about what do you think defines for you your generation of dentists? Because Ben kind of belongs to my generation, so.
For sure. Like, I believe my generation.
Sure.
There you go. The lingo.
That's a good one.
My generation is very set on AI, a lot of like social media, like marketing and stuff like that. I think that it depends, like obviously how you were raised, but a lot of people want to learn more, and they learn either through like Instagram or TikTok. It's like something that we're very exposed to, and it could be a blessing and a curse. You could be very educational, or you could like kind of give the wrong information. So I believe my generation is curious, they're creative, and they're innovative, but it really depends what you do with it.
You hit a very good point for me now.
Which one?
No, because what you said, it's true. And I'm going to divulge a story that when I came to take over the program that I used to run at one of these universities in New York, and they were a time that they didn't have, and I'm talking 2013. So they had a period that they didn't have leadership in that program. And when I came in, because of the lack of having supervision, so they started learning from YouTube. And this hit me. Like I'm Gen X. YouTube actually recently, because of the podcast, I started looking at it. To be honest with you. So, I mean, I'm going to admit it. And that lasted in my head. Oh my God, who is teaching these things?
Mm-hmm.
And so that's to go back to what you're saying is, it's true. Social media, you can get away with it, or get away from it.
Yeah.
Sorry. And but there is a risk. You just said it. It's a curse or a blessing?
Yeah.
Who is giving this out? And that spins into the story of the continuing education too. So I'm afraid of it. I'll be honest with you. I'm afraid of it. I think that there's so many information that can be misleading. And again, I'm just That's my opinion. I'm not saying that anybody's doing wrong things,
No, yeah.
but I think that I always brag about one thing. I say fundamentals never change. So there is essence for things.
Yeah.
So what do you think the new generation do not appreciate about the older what the older generation can give or have done? It's a deep question.
That is a very deep question.
But you're good. I know you can do it.
So my generation, what we don't appreciate about like the older generation, I believe like back to fundamentals, I think there's a lot of people my age that want to jump into doing like crazy surgeries, like all on X's, like kind of being like the super GP mindset and not respecting people's specialties. And that really does come with like, I guess, like the model of like having so much loans to like get back that you gotta like spend more on it. So I think my generation may not be valuing mentorship as much. Like they're trying to go out and do it on their own. And I think that's scary. But I can't really speak for everyone. I can speak for
I'm
myself.
I'm asking your opinion on one thing, because that's going to spin us to the second one is that, yes, you're right. It's a speedy. They want everything speedy.
Yeah, they want it now.
Yeah, and something else that you said, and that's not their blame. It's a blame of, and I wrote it in my book, it's that the dental education moved into what they call it comprehensive dentistry.
Yes.
I went to my specialty in 93, but and 93 was the turning cusp of so they used to go to the department to learn.
Okay.
Like you want to do endodontics, you want to do root canal, you go to the department and you do your rotation there. That's how you learn. Then they brought it all on the floor. That was what they call it, comprehensive dentistry. And they meaning the dental education people that they were involved in it, their idea is to expose the dentist to everything.
Yeah.
Well, by principle, it's good.
Yes.
But by application, it made everybody think that you can do everything you want. You are a super GP, you are a GP, you can do whatever you want, which is nothing wrong with that. Nothing wrong with being GP. It's actually, you need GPs, you need everything, right? But everybody needs to learn where the limits is. And that's where the mistake. I mean, I remember we used to have this dental student come to our rotation and they used to say, oh, you guys do these things in perio? So I thought perio is scaling and root planning. Well, yeah, because what do they do? Perio requirement, scaling and root planning.
Yeah.
So you know what I'm saying? So that was a big lack. And I think that's, you are seeing what we're seeing in here. But you brought up something very important. You talked about the student debt.
Yes.
So student debt, corporate dentistry, rapid technology have affected the way young dentists think about the future. Correct?
Of course.
So see how that whole questions and boom, dump them into one. So I'm going to start with, what should I call you? Which generation? Gosh, you confuse me. I mean, you are younger than me.
I'm X.
You're X?
Yeah.
Yeah. But he lives like a millennial.
It's the aura.
He's always stand, and goes on this long weekend.
It's the energy.
Really, I should feel bad for him, right, Dr. Tamay? I mean, really. All righty. So, Mister.
Yes.
Since Dr. Ben, you've had an experience in corporate dentistry. This is something people don't know. This man was ahead of his time in a lot of things. He made a big venture, and a lot of people copied him. He knows corporate dentistry, right? Let's put it this way.
Yeah.
So, corporate dentistry, student loans, technologies. Now, why am I correlating all?
Well,
You just said it, student loans. What's the problem with student loans?
they're just growing and growing.
Growing and growing. They're building up interest every day. It's like when you drive down on to 14th Street, there's this big thing that shows the U.S. debt.
Yes.
I know people don't understand it, what it is. It's that means every penny that we make has values down. So they come out with a debt, which I spoke about it in that podcast about dental school. Corporate dentistry, what do they provide for them?
Benefits, paid time off, competitive rates. An environment, even continuing education.
Correct. So they become an employee, getting a paycheck quickly. It reduces their headache about corporate, and corporate provide for them the technologies are very expensive.
Yeah.
Okay. It sounds magical. No. What's the drawback?
They're big contracts.
Big contract. What do you mean?
Well, from what I've seen, like I had a couple of friends that were like going into corporate and their contracts were like pages long, and it seemed a little bit like hard to read. And you just hear stories obviously on social media too of how like they can't like leave without like paying back a certain amount, or like they're indebted to them. And it just seems like a little loophole in there. Like it's never all that sweet, but I wasn't personally in it, so I don't know. But
no,
so,
it's true. But at the same time, is eliminating the personal touch, because now it
That's
becomes.
what I was going to say.
You need to return on investment and so on and so forth.
Oh.
There's more turnover with staff, with patients even, than the regular traditional dental practice. So you lose that relationship type of interaction. And, the younger dentists come in, they get their experience for a couple of years, and then they move on usually. It's not, So
how would you describe your philosophy of patient care?
I would say comprehensive. I try to assess the whole situation and come up with a plan that will remedy any issues that are going on, and so that it's cohesive and works well together.
And you, Melo?
ditto, but also like, putting the patient first, do to others what you would want to do to yourself. So, kind of treating them like family. Like, what would you want your mom to have? Like, do you think it's necessary to reduce this much? Like, being as safe as you can, but also informing the patient, because communication is everything.
Indeed. And so how do you build trust with patients? That's a very important point.
Yeah.
What differentiates you from anybody is that trust, right? So how do you think you are building trust with patients?
That's a huge question, because I have like a baby face, I'd say. So everyone's just like, oh, you're the dentist or you're the doctor. And they're...
Don't mind it, Dr. Ben.
I used to have a baby
blessing.
I used to have a baby face. I understand.
It's the young energy. But trust is huge. So a big part of it is like, thankfully, we explain to them like what x-rays are, like what's going on, like diagrams, kind of communicating to them everything they have, and like letting them take the final decision at the end of the day, because it's their mouth. So trying to get them educated so they could be in more control of their health. And that's our role.
That's a very good point. By educating them, spending the time with them, you give them more. And you, Mr.
Yes. Education is a very huge part of it. Giving them options, not confusing them with all the options, also trying to be very clear. And genuinely caring. I do genuinely care about the people that I see, and I want the best outcomes for them. As she mentioned, I try to think of it like the way you said, treat everyone like you would treat your own mother.
Yeah.
And I
how
think
about
throughout
your
my
father?
career, my father, he's already, we took care of him. I treat him too.
Both.
But I think they get a sense of that. They feel that I do care. And, through the years, it's been pretty good establishing trust. And it takes time too,
Yeah.
Yeah.
It takes time, but you guys said very important. You try to do the treatment comprehensive, and that's something that's very important. You're not patching here and there, and that talks value that you have ethics in it. And look,
It's
you tell
huge.
them the whole thing. If they want to do the whole thing, is good. If not, but at least
Yeah.
ethically and mentally that you did the right thing by them. So that's where the trust becomes, is that it's being honest, and that can be seen quickly
Yeah.
and felt quickly. We talked about technology, aesthetics. So aesthetics in dentistry is a big word, and what's your take on it?
Well, everyone deserves a beautiful smile, and that's also subjective to like who's seeing the smile itself. But aesthetics is huge. Obviously, everyone wants like the nice, bright, white smile, but like I think a lot of people are missing the fact that form follows function. Like ideally, the teeth should be in its ideal position, and then you could build off of that. But generating it based off like someone's face and knowing where like everything should look aesthetically is like ideally what everyone should be doing.
And you, Mr. Ben?
Yeah, I agree with that. Function also is very important because, if you do a beautiful aesthetic job and it's not functional, it'll be destroyed
Break
within.
apart. Yeah.
So you have to factor in all of that, and also you want to do something that in the end the patient is aesthetically happy with. That
Yeah.
that's the most important thing.
Like you might like it, but they're like,
Right.
ew.
Right.
Yeah, it's
You could
not
use
about
the
you.
gold
Yeah,
standards
It's
of
not about you.
everything.
Yeah, it's also the good thing about aesthetics. Some people make them feel better. And
Yeah.
it makes them rejuvenate.
Be confident.
Yeah, it works into their wellness. I mean, there is something to say. So when I get to the closing reflection before DJ kill me because I'm going over time, and DJ this is my thing with him. I always remember last time I was doing a monologue. I was talking to somebody that was him. So,
Oh.
that's DJ.
We love DJ.
He exists,
Yes,
he exists,
yes.
and he's a very nice guy.
Yeah, we had a good chat with him before.
Yeah, you think so? You can get a good chat with him? Oh,
Yeah.
wow, GG.
We had a long chat.
So finally, what keeps you excited about coming to work every day? Who wants to go first?
I'll go first. I truly enjoy the company of my colleagues
Mm-hmm.
on a personal level, and also it's a very talented group of people, and I learn from them. And the other thing is also the company of the patients. You build new relationships. You learn about people. You learn about their experiences. And yeah, it's different every day. So every person is different. Every situation is different, and it's a constant learning and experience, and that's exciting for me. It's never a dull moment.
Yeah.
And
Yeah.
you, my dear?
Exactly that. The learning. We went through all this schooling because we love learning, and like you learn in your own way, but learning like different patients' habits, like ways to treat things, like kind of a different approach. Not every smile is the same. So you know what to approach it with, and like the digital side of it, learning how to maneuver that, kind of growing as a person, but also like meeting the patient. Like they have great stories when you sit down and speak to them. It's like, it's fun.
It is.
Interesting people. Yeah.
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 So if you want anybody to know about New York City Dental Smile team, how would you describe it?
Collaborative, very innovative, and supportive.
Yeah, it's just a great team. Collaborative is a great word. We work very well together. We connect. We share
And we care.
opinions, and yes, of course, we all care.
We care.
Yeah,
We care.
that's
We do
very
care.
important for me.
So
like
on that note, I really want to thank you for making the time and to join me on that venture and that journey, and exactly what we do. We make people better and we care about them. It's not about anything else. Alrighty.
Amen.
Thank you for having
Thanks.
us. Thank you.